Hi, Dr. Desmond White, gastroenterologist. Today I want to talk about a very common bug that we see. It's called Norovirus, N-O-R-O virus. I say that because for the last 1 week, I've seen 4 cases of norovirus gastroenteritis being admitted. This norovirus or NORO virus is also known as the common stomach flu or stomach bug. It has nothing to do with the flu. It doesn't affect the nose or the throat or the lungs. It affects only the digestive tract. So patients that get this norovirus often will have severe vomiting, fever, tummy pain, and diarrhea for 3 to 7 days, depending on how they react and how much virus they ingested. I'm just looking at some data. In America, the Center of Disease Control, CDC, actually reported that there were an estimated of 20 million cases of norovirus in America per year. American population 350 million. If they get 20 million a year of cases a year, you can imagine how common, how severe it is in America. And it's estimated that they cause about 900 deaths in America every year. Most of those that die are people above age 65. So how do people get norovirus? Okay, it's transmitted by what we call oral fecal transmission. For example, if I am a patient, the thing that I vomit out and my poop will have the virus. If they go into food and you take the food, you can get it from me. So it is the setting that norovirus spread. Number one is any crowded places. So if I have the virus, I go to the bathroom, I don't wash my hands properly, and we're in the crowded places, we shake hands, we have a body contact, or I press the lift button, or I touch this, touch that, touch the light button, etc., and you happen to be there, and you can get it from me indirectly. Number two is it can also be transmitted in restaurant and in a catered events. Same thing, the food handler may not have clean hands. They may spread the virus from them to the food. Or sometimes raw food, raw seafood, raw meat, they may contain the viruses and they're not cooked properly. The virus can also spread among the food. There's actually one interesting news, or sad news rather, recently reported in the news that one Michelin star restaurant, the chef was jailed for causing a norovirus outbreak in the restaurant. This chef did cater food for a wedding. I think about 50 people came down with a norovirus diarrhea. When they investigated, they find that the raw, I think shellfish they served in the restaurant were contaminated. He argued that it's not his fault, but he was jailed. I don't know whether he appealed or he win an appeal. But it can spread in food. It can, if the chef or the food have been contaminated with the virus, they can spread it. Other places will be schools and childcare center. You know, our kids, they don't follow hygiene very well. So from young, my parents taught me wash hands with soap and water after every time you pass motion or you urine. That will be good. And before you touch food, put in the mouth or you prepare food, wash hands with soap and water as well. So another interesting thing is that more than 90% of the stomach flu outbreak on cruises are also caused by norovirus. You can Google this word and they will tell you that there will be some crews that have been infected with norovirus, that are a big outbreak, and we try to dock the crews, the port don't allow them to dock, want them to just remain in the sea, otherwise they will spread the virus to the whole ship. So it can spread in crowded places and closed spaces through food or through dirty hand. How do we treat it? There's no specific antiviral medicine against the virus. So they don't have a tablet to give it to them and they can kill the virus. No. The virus is self-limiting. They almost always recover, except in those who are very young and those who are very old. So how we treat them? We control the symptom, like give them some anti-nausea medicine. We give them lots of hydration. If they have pain, we give them pain relief. It is not recommended that you give them an anti-diarrhea pill. If they give you things like if you give them things like Imodium, they may stop the diarrhea for a while, but they may actually end up having more cramps. So we don't give anti-diarrhea pill when we know that they are having an infected diarrhea. And they almost always recover. Most of my patients, when they're admitted to the hospital, they stay for 3 days, sometimes 2 days, sometimes 4 days, depending on how bad the diarrhea is. We just hydrate them with fluid and salt, and we give them symptomatic treatment. Some probiotic may help. To sum up, norovirus, one of the most common viruses that cause diarrhea. It accounts for almost half the outbreak in the community and about 90% of the outbreak on the cruise. 20 million Americans out of 350 population are affected per year, and for those that are very young and very elderly, they may be at risk of getting severely dehydrated, and they may even die from the illness if they're very young or very old. Most of the mortality in America happen in those that are more than 65 years old. So there's no specific treatment. Treatment is just supportive, and most of the time they recover. So this is something about norovirus, or what we call commonly called then stomach flu. Doctor, that's right.